Do you ever wonder how often you should really be seeing the dentist? My name is Dr. Firas Bilbesi from the Dental Experience in Jackson, and my philosophy on preventative care is that if you can prevent bad things from happening, it'll be worthwhile for you in the long run and in the short run. It's less expensive, it's less painful, and it just makes for a better experience overall. Regular dental appointments are really important, even if your teeth feel fine, because there are a lot of things that don't really go noticed by us. Our bodies are really, really good at masking things. And so if you're able to come in for your regular visits, we're able to catch things a lot sooner than if we were to leave them for a really long time. So let's just say you had a situation where you had an implant and the implant had an infection that you didn't know about, right? They call it peri-implantitis. If you come in once a year, that's 1 year of bone infection and gum infection that's happening without us knowing about it. But if you were to come every 3 months, that's that's that can make a world of difference to being able to save that implant, to be able to keep the bone quality great, healthy, the gum tissue less infected, and it will again, create a better experience for you and potentially save your implant. Routine, yeah, routine checkups help us, they find early detection of decay. So, if you have a cavity that's small, it's easier to get to and easier to fix before it turns bigger. Sometimes it can even be reversed. We have a lot of technologies right now that can remineralize these types of things so that we can avoid the drills. It catches oral cancer, it catches gum infections and bone infections. It can help you prevent a situation where if a tooth was a little bit loose and starts to become a little bit healthier, you can prevent an extraction. If you can prevent an implant, that's awesome. But we need to work a lot more on treating infections and creating health so that we can maintain health and then essentially prevent us from having to do a lot more treatments down the road, a lot more invasive treatments, and a lot more expensive treatments. Yeah, there are types of patients that I would say fit into a category that should come a little bit more often than 6 months. And some of that is, we tend to call them our high risk patients. A patient that has diabetes, a patient that perhaps is a smoker, somebody that has a lot of medications that sometimes they get dry mouth. They need a little bit more TLC. Individuals that have things like implants should have their implants and their tissues monitored a little bit more closely. If you're high risk for decay, if you have a diet that's high in carbohydrates, or I've even had athletes sometimes drink a lot of sugary drinks or Gatorades or performance drinks. Those can tend to put your gum tissue, your teeth at a little bit higher risk for infections and decay. For our patients that have anxiety, we do have answers for that, right? So we have things like nitrous oxide, which laughing gas. We have anti-anxiety medications. So, no judgment from us. If you're in a situation where you feel like you need something to keep you a little bit more comfortable, we have that available. But the biggest thing is going to be talking to us as well. And so we're on our patient's side. We're part of your team. We're here with you. We're not here to judge you. We're not here to make you feel bad about anything whatsoever. Involve us, and we'd love to be there, right there with you. I mean, the way that we interact with our patients is very custom. Our patients, it's a very personal experience, and so there's no reason for us to really lecture patients. But my philosophy is if I can show you what's going on, if I can explain what's going on, then I don't really have to sell anything and I don't have to lecture anything. I really just kind of talk to my patients about what I see, what I observe, and what I can document. And the biggest purpose why we do that is because you don't know what you don't know sometimes. And so if we can see things for you, we use our loops, we use our lights, we use our cameras, we use technology, we leverage all of that to be able to provide you with information. And so the information gives you power to be able to decide what you want to do, and we can advise you on what we think, is a good idea. And ultimately, it's your decision how you want to proceed and what you want to do, and we're right there with you. If you haven't seen a dentist in a while, the first step is just giving us a call. Come in, get evaluated, have a conversation with us. We're ready to help. Check out our website or give us a call.